Ginille, a cosmetic nurse practitioner of 13 years. I've been injecting Botox fillers. I do all skin types, all skin tones, skin treatments that are safe. These are my before and afters. I can talk to you about any of the treatments I have done in our offices. We have 3. Jossie Skin and Wellness, or formerly Ginille Beauty Aesthetics. You can find us in Los Angeles. We got 2 in Los Angeles. 1 is in Torrance and 1 is in Mar Vista. And we've also got an office in the Summerlin side of Las Vegas. So please let me know if you have questions. You can jump on in here and we can talk through consults, anything on your mind. I will talk through any of the treatments that we offer, or if you have other questions on just aesthetics and you've been wondering, let me know. We can go through them. I'm trying to make sure my light, I don't know if that helps. Does that help you guys? Maybe. Just ask me anything and we can go through them. I can talk to you about the treatments I have done. This first picture of me was when I was 28 years old. I had not had any treatments, and now I am 38 years old. This was after I was breastfeeding my first of 3 kids. I've got 3. They're 2, 4, and almost 11. I breastfeed for like 2 to 2.5 years. It's just what I do. And I end up getting this fat sucked out of my face with those babies when they are drinking from me. So I felt this, like at 28, I just felt like I lost a lot of fat in my face here. And through my temples and my cheeks, under the eyes, I felt like I just looked tired. When we lose fat in our faces, people will feel like things don't look as lifted. It doesn't look as youthful. And that is really what I was feeling, and just also very dehydrated from breastfeeding a baby. Yes, please let me know any questions you have as we go through. So at that point, I was feeling pretty self-conscious, and I ended up doing some under eye filler. That was one of the first treatments I ever did, under eyes and into my cheeks. You can see even when I smile, I had like more of a little dip there just from losing volume. So this happens naturally as we age, but we will continue to lose volume just as we get older, and then with weight loss. So a lot of people right now are losing weight with the support of GLP-1 medications, Ozempic, Zepbound. We offer Zepbound in our office under a medically supervised weight loss management program. And so people will notice like their under eyes and through their cheeks just doesn't look as lifted. They start to get this line through here. They start to notice the smile lines looking deeper, the corners of the mouth looking deeper. As we keep aging, our chins start to sit back. We lose bone here. We lose bone here as well, starts to dip in. This will be the deepest part of our smile line. And then our temples will also start to lose volume as we lose fat through the sides of our temples. So I have since done every treatment that we have in our office. Anything I offer, safe for all skin types, all skin tones. I have done all of these things on myself, on family, on friends, and then of patients of 13 years that I've been doing this. And you can read our reviews if you look up under my name, Ginille Beauty Aesthetics. That is the clinic name. We've recently switched to Jossie Skin and Wellness, but if you read reviews, we have hundreds of reviews. We have lots of patient before and afters. I can go through, and show you different patient before and afters, their results, talk about the treatments they did, why they did that, and then you can see what natural looking, sorry, I'm trying to charge my phone, natural looking aesthetics looks like. And it's really a shout out to our patients for sharing these before and after photos, allowing us to share, because if it weren't for them letting us share, people wouldn't be able to see what natural looking aesthetics can look like. I really feel like if I was walking on the street, people aren't thinking I've got a face full of Botox and filler. They probably just think my skin looks nice. I have worked really hard on my skin. I used to suffer with really bad cystic acne, a lot of hyperpigmentation. I used to pick at my skin. I didn't know what I was doing when I was a teenager, and even into my 30s with hormonal acne on my lower face. And so not last night, the night before, I did a BioRePeel chemical peel. And whenever I do the chemical peel, I feel like my face is just glassy. Everybody loves this. Again, safe for all skin types, all skin tones. This is not a crazy peel where you're like peeling your skin. This one, you might have a little bit of flaky, but really it's just brightening. It's what a lot of our patients will notice. They also notice reduction in acne and fine lines and acne scars. Okay, let me go through questions. Beautiful work. Might ask where you went to NP school, thoughts on, I don't know those schools. So I went to undergrad at Stanford. I graduated there in 2009, and then I went to Duke for nursing. I did my bachelor's and my master's in nursing at Duke. And yeah, and I've been doing this the entire time as a cosmetic nurse practitioner. I worked in family medicine. I'm a board certified family nurse practitioner. I've been doing cosmetic nurse practitioner aesthetics since my entire career, since 2013. I don't know those schools. I'm sure they're great if they're accredited and you can pass the boards you need. That's all that matters. BioRePeel, is that the name? Yes, the BioRePeel is the chemical peel I did a couple nights ago, and I don't have anything on my skin right now, besides some moisturizer, which is nice, and you can tell it's just glowy. And my husband, who always says he can never tell any change with anything, if I do it on myself or on him, he's like, I never can see a difference. And I did the peel on him a few weeks ago, and then he asked to do it again. He's done it 3 times. He's like, hey, should we do that again? Like, I'm like, I thought you didn't tell any difference. And he said, I think I saw something. So men can tell. You can totally tell, and the patients love it. My favorite combination of doing this pill is doing it with the hydrofacial. So the hydrofacial is a treatment we offer, no downtime with it, but deep cleansing of the pores. And then we're infusing hydrating serums, different types of serums depending on your skin concerns, but you can add the peel on right after or like during the hydrofacial. I like that because that's like the glassiest of glass skin. I've only done it a couple times because for that I have to like ask one of our team members if they can sit down and do my skin for me. But the chemical peel is very easy. There's no downtime with it. When you come in, we have you wash your face. We are like really cleansing your skin and then apply the peel that sits on there for 7 to 10 minutes. You might feel a little tingly. We wash that off after. You can put on a hydrating serum. We can put on your sunscreen. But I mean, seriously, this is what I expect after, and the patients love it. They always see it. Is it only done in the medical spa? Yes, it is only provided to licensed medical professionals. How often should we do it? The company says 7 to 10 days. I have found like twice a month is good, or 2 to 3, like every 2 to 3 weeks is good. I have done it when I started doing it like every 7 to 10 days. The peel is still active from like the last one, and so I was getting a little bit too dry. I started to get a little flaky, and I didn't like that. But I would say twice a month or once a month at the very least. So that's great. Microneedling is awesome. You can also combine microneedling with the BioRePeel the same day. So we offer skin pin microneedling in our office for that one. We numb your skin, and then it's like an electronic pin, and it's going on the skin. We have different depths that we do on the skin depending on your skin concerns and like your baseline. And then after we do the microneedling, we can apply the peel immediately after. So for people that have more like skin texture, acne scars, those are the ones I really love combining the microneedling with the peel, because they're getting more of that controlled injury with the microneedling and then the peel on top, and it can penetrate a little bit deeper as opposed to just going on the surface of the skin. My personal self for microneedling, like I'm on camera all the time, and in office I'm wearing a mask, and I don't like to feel flaky and itchy underneath my mask. With the microneedling, there's a little bit of downtime. So for the first 48 hours, you got to keep the skin really clean. Hair off your face, hands off your face, no kids, no pets, nobody touching your face, sleep on your back, no makeup, no sun. Like you want to be like just open skin right now, because we don't want to have anything penetrating into those open wounds with the microneedling. So for my personal self, that is just me. And I don't really have a bunch of texture concerns because I've done other treatments over time. So I'm not really trying to work on microneedling. Like I just don't want the downtime of it. However, having said that, a lot of patients love the microneedling. They will combine it with a laser and or the chemical peel the same day. So we have Aerolase laser in the office. Again, safe for all skin types, all skin tones. There's no downtime with the laser. Really good for acne. Anybody that has active acne, hair removal, any redness, any skin inflammation, go the laser route. The DPN. So I need to snap a picture. I used to have all those little moles all over my neck after my pregnancy. Like, people were saying Morgan Freeman moles. Like I had those all over my face and neck. Zapped all those off with the laser, and there's no downtime with it. So I do love the laser, and I was probably doing the laser consistently for a year, almost every month. And I love the laser. I just have to find one of the girls to zap me. So the peel, I can apply myself. I don't have to have any one of my team members assist me. And I feel like I get a little bit more immediate glow with the peel than the laser. All of these things have a place. Is Aerolase just as good as Fraxel Dual? So they're different, Carrie. Aerolase is major. So Aerolase, so Fraxel, I used to work with Fraxel in one of the medical spas I was previously at. That is going to be more of a controlled wound. Aerolase has no downtime. There's two different Aerolases. The one we have has no downtime. Your Fraxel, you're going to have some downtime. That is where you can work more on some like collagen remodeling. You can work on like just deeper wrinkling, more pigment. There's going to be some downtime with your Fraxel. The more downtime you have with the treatment, the faster you see results. Fraxel, so in our office, and I'm Filipino and Black, in our office, I see all skin types, all skin tones, and I can flip through patient before and afters and talk about the different treatments they've done. But like not everybody can do the Fraxel. And so like I would have to start turning the settings down to be treating darker skin types. And so I don't want to be like turning the settings super low, but that is a good treatment, you know, as long as you're a good candidate for it. Okay. Are you in Vegas yet? Yes, I'm live today. So I'm in Vegas. I'm in LA, but I live in LA. I go to Vegas a couple times a month, but we have a whole team that sees patients there. They're there all the time. So our clinic is Jossie Skin and Wellness, JASI. And if you go on my page, you can click, that's the clinic name. You can look up there. If you look it up, you're like, I don't see any information on there. It's because the clinic in general, I've been on my own since 2021. It started out in my name, Ginille Beauty Aesthetics. So if you were trying to like read our reviews, trying to see patient before and afters, if you look up Ginille Beauty, that's where you'll see them. We've just transitioned out of it being my name because we have like a whole team of providers at all the offices, and it's not just me that sees patients. How soon can I get the chemical peel after microneedling? Gab, you can do them the same day. Microneedle and then put the peel right on top. If you want to break them up, I would wait like 2 weeks in between. It does yeah, that's going to be good. Let me scroll through these other questions. I hope I didn't miss anything. You put me on the lip flip and DAO Botox, and at 40, that did it. I'm so happy. Oh, hey, Mac, love you. Thank you. Don't, you're so funny, Mackenzie. Yes, so Botox, guys, that's like I say, you know, late 20s, early 30s, at least doing your frown, your forehead lines around the eyes. It just makes everything look smooth. It helps the lines not get etched in on your skin. You know, people like, we don't need any of it, guys. I know none of us need it. None of us need it. However, people just want to look and feel like their freshest selves. You know, they want to be able to, the outside to reflect how they feel on the inside. I've heard so many great stories from patients over the year on just the confidence that they'll feel when they see their skin is not breaking out and not having dark spots. They just feel better. They feel like, I've had people say, I was able to get a raise. I was like, this didn't get you a raise. And they're like, yeah, I was more confident. I asked for a raise, or this helped me get into a relationship or get out of this relationship that I didn't want to be in. So little things, everybody has their reason for why they want to pursue aesthetic treatments. And yeah, so I'm so excited that you got to do some Botox, and I know people were like, it's Botox. I'm like, guys, it's not like that. Like, you can look fresh and you can look natural, and I'll show you patient before and afters. This is just mine. I can flip through them. Okay. Which laser do you use for DPN? I have a ton. So the Aerolase laser, and I did not set that photo up of mine because I have really good before and afters. They were all over my neck after my last pregnancy. I'm just going to scroll through these pictures, these questions, and then I'll go through patient before and afters. And if you want to jump on live, patients will come on here and we'll do our consults through here as well. How much is microneedling? In our office, in our membership program, it's $3.99 a month. You can do a single's not really going to do, like, none of these things are single treatments, guys. You know, you can do one, but it's not going to really, you need a series of these treatments. So $3.99 a month for any of our skin treatments. And we can help guide you depending on your skin concerns. And we might be changing it on a monthly basis. We have the microneedling, skin pin microneedling. We have Aerolase laser, BioRePeel chemical peel, and then our hydrofacial. So everything we offer, safe for all skin types, all skin tones, they can be combined. So a lot of our patients are combining multiple treatments, multiple modalities on the same day, depending on their skin concerns, depending on what's going on. So if they want, again, the glassiest of glass, that's going to be the hydrofacial and the BioRePeel same day. So I did the BioRePeel on its own, but my favorite is when I have the hydrofacial with it, because I don't feel like dry. I feel a little dry, especially it's cold out right now, but I'm feeling glassy. So that's if you have to get ready for an event, you want your skin to glow, hydrofacial and BioRePeel chemical peel. If you're really dealing with acne scars, okay, if you're dealing with acne, we'll start acne, go with the Aerolase laser. And then once we see how you tolerate that, you can also add on the chemical peel same day. If you're dealing with acne scarring and no more active acne, that's when we're going to go in with your skin pin microneedling with the Aerolase laser and the peel, the chemical peel, same day. So it's more aggressive. We're working on different depths in the skin. But the more aggressive we go, the faster you can get to the results, and they're going to be safe. Okay. Is PRF or PRP better for under eyes? Do the PRF natural filler, the easy gel. So that's we're combining. When we spin it on a setting for PRP, and then we heat that PRP component, platelet rich plasma. That is going to be the binder for your PRF. So then we do a separate tube that we spin for PRF, and then we mix that heated PRP with the PRF. We cool it, it makes a gel. It helps now bind your PRF to last in the skin a little bit longer than if you just injected straight PRP or straight PRF without heating and cooling it. So that heating component gives you a little bit of an immediate lift. You get longer exposure to those growth factors in the skin. So yeah, and I love the natural filler. It's the only one I've been doing for the past 2 years. Guys, I love filler too. I'm not going to diss filler because I love it. I've had it all over my face. I just haven't had it for 3 years because I'm breastfeeding a baby. Yeah, he's not a baby. He's 2. And so when you're breastfeeding, you can't do filler. And I've been doing the natural filler. At first, I was like, I don't see a change. I don't see any difference. This didn't do anything. Over time, I'm like, oh wow, it's not like I don't look so haggard. I don't look like this when I was 28 and breastfed the baby. It sucked the life out of me. They always sucking the life out of me. And I have 3 of them. I don't look like that anymore. Like I don't have the sunken. I don't have this, like it's just not as much. I'm not as like hollow. I don't have as much volume loss. My temples and the natural filler, I've done temples, eyes, cheeks, smile lines, corners of the mouth, chin, here, my whole face, everywhere. The natural filler, you're not going to go wrong with it. It's never going to be overdone. It's never going to look weird. You're not going to have lumps and bumps. You're not going to have any reaction to it. It's made from you. Now, the younger and healthier you are, the better the outcome. So my 20s to 40s, they love it. Even 50s love it. If they're healthy and they're not like smoking, drinking, drugging all the time, poor diet, I'm like, your body's not going to have a good environment to make new collagen. But in general, that natural filler, our patients love it. And some people that they're not candidates for filler or they just choose they don't want to do filler, they will start with a natural filler and they're like, this is great. Like I don't ever have to go to filler. And me right now, usually when I breastfeed, I am like fiending to get some filler because I'm sunken in my face and I feel pretty self-conscious about it. So this is me after breastfeeding 10 years ago. Almost 11, he's almost 11, but this is me before, and now 10 years later, I don't look so beat up, but again, I've been doing the things. So the natural filler, I tell people, I'm like, if you're in your 30s, like start that. And like, I don't feel like I don't feel like I have to kick this kid off so I can go get some filler. I mean, he's big, he should be kicked off, but like, I'm not feeling like I need to go do something. Like sometimes I see a little shadow here. It's like nothing that I'm feeling self-conscious about. If I see something, I'll put the natural filler and it's cool. So I really am a proponent for that. And I was slow to bring it on because I was like, I don't think people are going to see the results. That was the biggest thing. But the patients were asking me for probably 2 years before I decided to like, if I do something, I want people to get the result. I like need to stand behind it and I want to feel confident in it. I want you to feel confident and feel like you got what you wanted. I probably wouldn't have gone this hard on my own self only doing natural filler. It's just because I've been in that position of breastfeeding the baby that I couldn't do filler. And so I did the natural one. Like I said in the beginning, I was like, I don't see any change. This didn't do anything. Over time, I'm like, dude, I don't look so beat up. So, okay, what's the difference between what you did and Botox fillers? So the natural filler was made from my own blood, nothing else mixed inside of it. And I've done Botox and fillers too, guys. Like I perform all these, and a lot of my patients will do multiple things. Some people like want to do regular filler in their lips because they want an instant result and they want to see that instant lift. And then they might be doing natural filler underneath their eyes because they are not a candidate for a traditional filler under their eyes because they cry or they get puffy or they have bad allergies, water retention in their eyes. So this is why we'll do a consult and we can talk through, like I ask a bunch of questions about you, about what's upcoming, about, have you lost weight? Are you changing weight? Any medical history? If you've done treatments, however you responded to those. I ask a bunch so that I can see and make sure that whatever treatments we do, that they're going to serve you and you're the right person for it. Okay, I'm trying to scroll through and make sure I hit all these questions up, and then I promise I will talk through patient before and afters. Should I micro needle or chemical peel first, 3 to 4 weeks apart? Probably. I would probably do microneedle first, but they're both great. Or do them the same day, and then do the same thing again in a month. Okay. Okay. I'm trying to make sure I didn't miss these guys, and I'm gonna go back down because the other day someone said you ignored my question. I'm never trying to ignore any questions. I just want to. I'm talking too much. Sorry. Okay. Now let me go down to them. How long do natural fillers last? So the natural filler, the intent with the natural filler is that you're going to get new collagen where we place it. So your body, it can take up to 6 months to see the full effect from natural filler, because that's how long it takes your body to make, that's how long it can take for your body to make new collagen. Once you get new collagen, it can last for years. However, we do keep aging, so it's something to keep in mind. So I tell people, I'm like, again, the healthier you are, the better the outcome. But yes, the results can last for years. You want to do some maintenance in there because you're still gonna get older. And like, if you're not having a healthy body, you're gonna have crap results. We don't want that. Okay. Do you practice at all of your medical spas or just in LA? I go to all of them, Stephanie. So we have 3. 2 are in LA. 1 is in Torrance, Mar Vista, and then 1 is in Las Vegas. And so I go to all, and then we have team members in all of them. And these girls are excellent guys. I wouldn't bring somebody on that wasn't excellent. Like, I'm too crazy of like, I just want everything to be like the very, very best, period. I went to Stanford. I went to Duke. I've been doing this a long time. I get out here and I talk about these all the time. So like, my name is behind it. I would never want to, people are making videos and talking about their experiences. Like, I would never be like, go see this girl and she's crap. No, and that's my problem. Like, no, these girls are excellent. The patients love them. They have their own book of patients. Like, people love them. So go see the girls. I trust them fully. They inject my face and they're excellent. They do my skin treatments. That's why I'm like, dang, I would like to do the hydrofacial or the laser. I just need to find somebody that's not busy with patients to zap me. The name of the one in Vegas is Jossie, Jasi, Jossie Skin and Wellness. And our website, guys, is going to probably be finalized this upcoming week. So we were switching to new medical EMR system, like a new electronic medical record system, and a new website, because I wanted to make the booking for people to just be easier and seamless. The current one we have, I was like, why is it so tricky to book online? So that will be out. But if you call or text the number at the top of my page, my team, like, I even see every message that goes through. So just do that. You can DM me. Sometimes I just miss the DMs if I'm in with patients or about to be with those babies. Like, I just miss the DMs. But if you text the number, we have team members that are on that. Then we'll send you any information you have. We can send you videos. We can send you pricing. We can send you like a way to set up a consult, all the things. So we can go through any and everything. Okay, let me see if I missed any. Can I get your thoughts on Thermage and would it help with jowls? Nancy, so I used to work with Thermage in one of the offices that I worked at for probably 7 years. I was there for a while. I will tell you the results that the patients were saying was always like mid. They'd be like, I think I saw it. I think like, and so it wasn't ever convincing to me. Like, maybe somebody would say, I really liked it. And then the next person would say they saw nothing. So it was too iffy for me to be like, dang, I believe in that. And that's something I can like stand behind. I want to get treatments that people are like, I see the results. I need to hear that from people. Otherwise, I don't want to bring it into the office. I'm not trying to like hype things up that are not going to get the results. So for Thermage, helps to give a little bit of a tighten, a little bit of collagen stimulation. You probably got to be the right patient for it. You don't want to have too much skin laxity. It's not going to be a surgical thing. So I think it's like what the expectations are. If you want something very subtle, you can try it. But I mean, also it's kind of pricey. So I just felt like it was like pricey and then people wouldn't really see it. I just can't deal with that. Like, no, if we're going to do it, we need to get the results consistently. And I need to get it on all skin types, all skin tones. I need to see it multiple times over, all of that. And I wasn't seeing that. If people don't love it, I was like, yeah. So I don't know. Same for Ulthera, Profound. I've worked with like several skin tightening devices. There's none that I like really believe in. I know a lot of people have asked me, Soft Wave. I don't work with Soft Wave. I'm like, guys, also when stuff is new to the market, be slow to like invest your money just because the companies will have a lot of marketing dollars behind it and they will hype stuff up. This happened, I feel like, with Morpheus. I'm not trying to be on here like talking bad about these companies, but I'm just being real with you. I will listen for a couple of years at minimum before I decide to bring something on, and I will ask my patients, hey, you went and did that? Can you tell me about it? If everybody's like, I'm like, nope. Not going to bring it into the office because like I have to stand behind it. Whatever I bring in the office, I'm going to talk about online. Like I don't want to mislead people. I don't want to be trying to take people's money and then they're not happy and refunding. Like, I'm not doing that. I'm like, if I say something, I'm going to get the freaking result, period. Okay, let me go through it. Best treatment for laugh lines. So smile lines, you can do the natural filler or you can do traditional filler. Natural filler made from your own blood, your growth factors and stem cells. Traditional filler, hyaluronic acid or calcium-based filler. Depends on how deep the lines are. You're not trying to get them all the way gone. I mean, I tell people don't get them all the way gone because it'll look weird if your face is puffy. So you want to be mindful of that. You don't want it like blown out. And then also when we're considering smile lines, guys, I say it's not just here, but think about the corners of the mouth. Because if you just have this softened and you got these sad lady lines, it looks bad. Also, we're losing volume starting from our temples into our mid face. So if you got volume loss through here, you got this deep line here and this deep line and this deep line, and you only do your smile line and this is saggy, looks bad. So when we're doing treatments, we're always considering the full face when we're doing it. We want to make sure we're not just chasing one spot. When people chase one spot, guys, you see it. You see these people walking around, you're like, oh, she did her cheeks. Oh, she did her lips, because it's the only freaking spot they did on their face. I'm sorry, I'm not trying to be mean. It's the only spot they did on their face and it looks bad. So just make sure, you consider your full face. Don't just chase the line. If you have like great volume all through there and it's just your smile line that, you're noticing some sunken, some hollowness, some deepening, yes, just treat the line. But if it's other parts, don't only do the line or it will look off. I say that to you guys. I mean, even my own self, I should post up some pictures of me. There was a point, and I need to finish going through the questions. There was a point where, they had come out with Voluma. They launched Voluma like pretty soon after I joined an aesthetic. So this was about 13 years ago. And they kept putting it in my cheeks. Oh, let's see if we can see it lift. I'm like, I don't see a lift. All of a sudden I had these like big cheeks and I had this like short chin and like my face was like puffy here. It just looked weird and sunken above and puffy and short. It looked weird. Like, no, we don't want to look weird, guys. And I think it also comes down to who you choose as your injector. If the injector doesn't understand and they're like, oh, I'm just going to give you these snatched cheeks and then above it you're sunken and your chin is short, it looks bad. So we want to be mindful that we're thinking about the full face and how the face is aging. The way we injected our office, we're thinking about underneath the skin, where a fat pad's separating, where we're losing volume. That's how we inject. And then like making sure we're using the right product in the right person, because every face is different and these products are also different. So I can't use the same product on every single person. So, people like, my best friend did this. I don't even really talk about products on here. Because I don't want people to come in and say, I want this brand filler name, because they're going to come in. I'm like, but that's not the one that's going to get you the result that you need. Your face is different. So just know this is why you want to go to somebody thoughtful. Look at their reviews, look at their patient before and afters, do a consult, ask them a bunch of questions, try to like trip them up. I'm like, try to trip me up. Like, I have nothing to hide. And I have so much thought behind every single action that I do when it comes to the person's face. And this is why I go through so many questions with the patient and then so much talking about, hey, what to expect and how we're going to do this and and the limitations of it and the alternatives to this. If you don't want to do this, like here, maybe you should do a surgical consult. I tell all the things in my head to the patient. I'm like, dang, I know I'm talking a lot, but I want you to understand this is my thought process for you specifically and why we're doing this. And the same for the girls when I have been in their rooms and hear their consults. Like, we all are doing the same thing on our team. Okay, I said 28 messages. Let me try to make sure I don't miss these guys. Please answer. Marissa, I know I'm so sorry. Let me see if I can find your question. I don't have a jawline. What can I do if I only have 2K now, or should I wait? I'd have to see. Let me show you some photos. Let me show you some photos of people that say they don't have jawlines. Because 2000, maybe be able to do your chin and that can make a big difference. She did her chin. She didn't feel like she had a jawline. She didn't feel like she had a jawline. We did her chin. This was about 3 syringes. 3 syringes, they're $9.75 a syringe. So So it depends on how far back your chin sits. Is it your chin or is it the jawline, the no definition here? Sometimes if people don't have definition here, it can still be bringing forward the chin helps to balance the lower face and harmonize their jawline. There's one that I think is really nice. I'm trying to scroll on my phone, guys. I set up like 30 photos to show. So here's one. Yeah, so this is what somebody might come in and say, like, I feel like my jawline is weak. I don't have a jawline. And so we did filler into her lower face, into her chin. So 3 syringes. When I do the chin, it's not just here. We don't want to just put filler here, guys, or it's going to look like a ball. We got to connect it to the jawline. So we call this pre-jowl sulcus, kind of hiding this jowl fat pad. And then we do some into the corners of the mouth. But I mean, I feel like her jawline looks way stronger without me actively going in and like treating doing all this. I really focused on this part. And you can see her before and after. That was 3 syringes, $9.75 a syringe. So around, under 3,000, around there. If it's only 2,000, if your chin does not sit super far back, you might be able to get away with doing 2. So I don't know. Okay. Let me make sure. These. When will we be in Vegas? I'll be there on the 14th of November. I was there twice this month, but we also have team members, guys. If you want it, the girls there are excellent. Definitely start your skin treatments. Vegas, I will say consistently what I've seen is just dehydrated skin. I was like, dang, this is the desert. So a hydrofacial and chemical peel, like go do that if you're in Vegas. I love I love all the skin treatments, but for the hydration, and it's getting colder right now, I'm like, go for Vegas, go start your skin treatments. Okay. She said no definition. This one, Marissa. Okay, so hopefully that helps you. Let me see. She said no surgery. I don't know. She did not do surgery. None of these things I'm going to show you are surgical. These are all non-surgical, and I can flip through a bunch of these photos of patients and talk about the things we've done. If you have fullness underneath, you can do like liposuction. I'm not a surgeon, so I'm not going to talk too much out of my lane, but you can do get fat sucked underneath. You can also do a chin implant, that's a surgical thing. But I mean, this is without surgery. And I tell people 1.5 to 2 years, a lot of people it lasts longer on, which is great but you want to make sure you go to somebody right, because you don't want it to last long and it looks weird. But yeah, it's like, I did this in like 15 minutes, like probably less. And she walks out, she looks hot. Like, you're going to bruise, you're going to swell 2 to 3 weeks. Maybe it'll look a little extra and it settles down. Okay. I will answer these questions. I got Sculptra 6 weeks ago for the malar crease, but I don't see results. What should I do? Jennifer, it takes multiple sessions with Sculptra. And so it could take up to 6 months for full results from collagen. So it just could be time. 6 to 8 weeks, usually do a second one. Sculptra, I use in my office. I feel like I see a little bit quicker results with dilute radius for collagen stimulation. Okay, I hope if I missed a question, please sit up. I'm trying to do it. Would you address, what can you do to address I think she's saying like around the eyes. Maylor, I love it. Thank you. What can be done for congested skin, painful zits that take a long time to go away? Okay, malar crease through here. You can do filler. You can do natural filler. I feel like that really helped me. If you get puffy around your eyes, if you swell or retain a lot of water, don't do filler, or it will be puffy and look weird. As I'm talking, I will click through some photos and then I can talk through any of these. Oh, I hope I didn't cut that one off. I had to like go through and just put these on my phone. Okay, for congested skin, painful zits that take a long time to go away, I want you to do the Aerolase laser because we want to kill that bacteria in the skin. No downtime with your laser. It's going to kill bacteria. It's going to help with inflammation. It works so well for acne. I feel like that laser, and there's like 36 different FDA indications for the laser, but I feel like acne, it's so strong on, and it's safe for all skin types, all skin tones. Boys love it too. For the acne, it works very well. Laser, and then go and get the hydrofacial, and you can do it the same day. So the hydrofacial is going to go and deep cleanse out those pores, and it's going to help with just cleansing. So do those 2 same day. That's what I would say. And it's going to work well. And the laser, that Aerolase, excellent. I'm trying to make sure I didn't miss any questions. I'm a government employee. As soon as I get paid, I will schedule to see you. I would love to see you. I'm so sorry about what's going on. This sucks. I want in between the eyes for 11s, but it is because I have a prominent vein, not a wrinkle. If it's not like the muscle flexing and like making the line, I don't know if it's going to do anything for your veins. Okay, let me see if there's other ones. If I didn't answer your question, I am not trying to miss it, I'm just talking too much, guys. So you just paste it back, and I will do it. Do you do aerolays monthly? I'll be traveling from KC. Yes, if it is for yes, and you want to do at least. It really depends on your skin concerns. 3, at least 3. But if it's like we're like most people, that around 3 they start getting excited, like they can start seeing the change. 6 is when they're really happy. So something to keep in mind there. I still whoa, I got babies in here. Daddy's downstairs. Oh, okay. I love you. Bye. I have 3, and I did a. Where's Daddy? They're just running and they're crazy, and they just came from their little parkour jumping class. I've got 2, 4, and 11, almost 11 years old. Okay, do I come to New York? No, but every time I'm online, people ask me about New York. I got like halfway through applying for my New York license. I need to finish that. Okay, let me hit these. I'm 43. I have 2 syringes in sculpture. I still feel like I need more filler. Should I do 2 more syringes? Ms. Vasquez, let me see if I can see your photo. Oh, so beautiful. It depends on what you're trying to do. It might be, and it depends on what part of the face. So when I'm doing, I'll keep clicking through pictures, guys. When I'm doing faces, it could take, anywhere from 2 to 3 in the upper and 2 to 3 in the lower. So I know people are like, oh my gosh, that sounds like a bajillion syringes. Let me break it down. Like if you're doing your under eyes and your cheeks, that might be like 1 to 1.5 syringes per side. If your face is more like sunken, more hollow, it might take a little bit more. If your bone is deep, it takes more. If I put the needle in and it's like, oh, as soon as I put the needle in, I'm on your bone, it takes less. So I always give a range to people, but I would think like 2 to 3 up through here, your mid face, and then 2 to 3 for your lower. That's like about average. I say this and I want people like, that's 1,000,000 syringes. I'm like, guys, and I can show you these people all got like multiple syringes in their face, but they look fresh. Like if you just look at her after, don't look at that before, just see her after. If you see that lady walking down the street, you don't think she's doing a bunch of filler in her face. Look at just the right side of the photos. They all look natural. It depends on the face. It depends on your concern. Here's another baby of mine. Hi, baby. You can't be here. I love you so much. Okay, Mommy's gonna do this call, okay? I'll come right back. He's trying to ask for you know what. Hold on 1 second. Okay, he's jumping. Hi, Mama. Okay, he's gonna see RY in a second. Okay, baby, give me 1 second. Come on, Mommy, see you. Go get a treat. I'll be right back. Oh, let's go get a treat. Okay, Mommy, be right there. Okay, I'm gonna come down in like a few minutes. I'll see you right back, Kenny.
Oh, do you wanna go get a treat? Oh, do you wanna show her the new clothes?
Sorry, guys. People were like, what? But this is my real life. Okay, let me see if I miss messages. But it could take multiple syringes. It depends on your face. So for her, we did her under eyes, her cheeks, her lips, and her chin. This girl did it was between 4 and 5, like 4.5 syringes, 5 syringes, somewhere in there. And she looks fresh. She looks natural. It can take multiple. So I want you guys to know that. But I'm not saying shove a bunch in there. So when I give people those ranges, I usually tend to be on the lower end of the range. And then I say, hey, let this settle. Let's reassess in 6 to 8 weeks, because as I'm injecting you, you start to swell, you could bruise. I need it to settle, and then we reassess, and then we can talk about if we should do more, if you want to do more. If you're like, this is perfect, cool. But it does take some time to chill. Okay, you guys are probably, let me read these comments. I hope nobody's like, what is wrong with, go get your children. I know I need to go get my children. Okay, what should I do for baby fat loss around my cheeks? Face looks more sculpted now, and I don't like it. So volume replacement with either filler or the natural filler. Okay, do I fill the mandible? Yes, I will. If somebody's trying to make the angle of the jaw more defined, or along here. So mandible is just your jawbone. Malar mounds through here. If you're puffy, if you retain water, don't do filler. You can consider natural filler. Be careful there if you retain water. Someone said, oh, that's so sweet, the babies. Average price. So prices per syringe, $9.75. Just, you can say around 1,000. So $9.75. You're gonna do 2 to 3 up here, so around 2 to 3,000, and around 2 to 3,000. Now, not everybody is doing their full face. Some of those faces I showed you guys, let me see. Their primary concern is lower face, so she's lower face. Oh, and she did her eyes too. People are doing their full faces, guys, because they're not just trying to look fresh on one part, but lower face. Hers lower face. Now her chin, her chin is back, but it's not super far back. I did less on her. I think hers was between 1.5 to 2 because her bone was not super far back. And yeah, like she looks great. Like we know she didn't need anything. She's beautiful. But for her, she was like, I feel like she came in and she said, I feel like my lips look ducky. She'd never done anything beautiful. My lips look ducky. And it's because and I feel self-conscious from the side because my lips go over my chin. And so we did some filler just into her lower face. So that's 1.5 to 2 syringes, around $2,000. Now she's young. She's freaking gorgeous. She doesn't need anything, else. I'm not like trying to be like, oh, do your cheeks and your eyes. She was young. She didn't need anything. She just felt like this was her concern. One second. Okay, let me see if I'm missing messages. You should do a pop-up in Maryland. Thank you. Okay, Daxify. Does it burn when being injected? I have not used Daxify since it launched. I used it in the beginning and then it wasn't really lasting that long on people, so I don't remember. I think they said it like stings a little bit more, but yeah, I just wasn't lasting that long for people, so then I stopped it. Okay, I'm going to try to make sure I didn't miss any what's the average price? That's what bothers me. Somebody said somebody's bothered. Sorry guys, let me make sure I'm not missing any questions. Okay, I don't want any treatments without you seeing my skin first. I think hydrofacial, microneedling, and forehead fill. Yeah, so this is why we'll do a virtual consult. I'm gonna have to go. No. He just wants to drink, guys. He would sit here and just drink as I'm talking. He just wants to drink all the time. That's why I'm like, I know I'm about to feed him all night. Anyway, I need to stop breastfeeding this big 2-year-old that eats hamburgers. Okay, I'm only doing 1 syringe of filler and Botox, and I'm just wanting a natural look. I'm 52. Cool. I tell people, I'm like, do what's going to make you feel the best, the most confident, and the most refreshed. That's all that matters. Don't worry about what anybody else is thinking and doing and wanting. Do what works for your face, and I want you to feel beautiful. Let me show you. I think I was clicking through these as I was talking earlier. In general, so she did nose filler. This is random. So she is young. Maybe we were working on some skin, but she was coming in because she felt like she didn't like the bump on her nose. She wanted the tip lifted. She wanted it to be smoothed out. So did this over a couple sessions. This is after it settled, made it look straight along the nose and lifted the tip. So, she's not doing her full face. Not everybody's doing their full face. However, we are considering the full face before we inject. So we're talking about skin. We're talking about how the face is aging. When I'm getting somebody that's in their 20s and their concern is just like the nose bump, they might not need to do something. Now, if it's their lower face, if they're saying, oh, I want to do my lips. Remember that other girl that I showed that's so cute? If she came in and she was like, I want to do my lips, I would probably say, hey, girl, we could do your lips. However, it's not just from the front. People are seeing you. People are seeing you here, 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 all the different views, and your lips might overpower your chin. Now, if she's like, I like that look, okay, cool. But if she's like, oh, I don't want it to look ducky, I don't want it to look unnatural, that's when I say, hey, should we consider your chin? Now, I tell people, it's never my way or the highway. That's why I say, you can consider this. Or, hey, this is how the face ages. Or, hey, when I look at your face, this is where you have more highlight, more volume relative to the other features. If you're I've had people tell me before, they're like, I like my chin back. I'm like, cool. I'm not trying to take away something that you like. So then it's, what are your concerns? Okay. Or they say, I like my chin, but I don't want it all the way forward. I just want a little bit forward. Okay. So it's really customizable. That's why we got to consult and see what your concerns are, what your goals are, talk through everything. I think CJ has such great photos. I've got both of them lined up today so you can see from a couple different views. So she, full face, and I don't need to be bigger. I want her to be bigger. She came in and she was asking for lips. We did that once, and she came and Botox, and she asked me again another time. I was like, girl, if I just keep doing your lips, these lips look fresh, but these corners of the mouth and this chin, it sits back and the cheeks are not lifted. It's going to start looking like you got your lips done. If you don't care, but that's the only part that looks fresh. We got to make sure the whole thing. And her birthday's her birthday just passed. She's having a birthday party, 50th birthday party, and beautiful. So we ended up treating her cheeks, her smile lines, the corners of her mouth, the lips, the chin, and then this area we call pre-jowl sulcus connects the chin to the jawline, so her jawline looks straighter. And look after, she looks so hot. She's beautiful before, period. But like she even said, she was like, dang, I look hot. She's like, my husband was like, whoa, you look like that before? And like she's like, what? So, and she shares all these stories online too. Okay, let me see. You're 30 minutes from me. I'm definitely coming in for nose filler. Kelsey, I would love to see you. Let me show you some more noses if I have some set up over here. Here's a nose. And the nose thing, everybody's nose is different. Everybody's concerns are different. She has this little bump, you know. I'm like, nobody's seeing that bump for her. She's like, this is what concerns me. I don't want the tip to be downturned. I want to camouflage that bump. It's subtle. We made it straight. I have, let me just see some other noses. Some people want it straight. Other people want their nose turned up. Here's a good nose. We did this. So she was like, my family is not going to let me get surgery. I don't like this. I feel self-conscious. They said no. I think she was like 18, 19 or something. And she had a bump. And so this was over a couple sessions. So like I have like the progression photos, but camouflage the bump, bring out the tip. I mean, it looks freaking straight, dude. She didn't have to go do nose surgery and heal for a year. Like, and she didn't have any bruises. Like I was swollen for a little bit, but yeah, like that's the goal. Okay. What's the cost? I have a little bump. It is $2,000 and I do it over 2 sessions. So we do some, let you settle, come back, fine tune if we need. If you're like, it's perfect at that second session, I don't need to do more. I just want to add that second session in if we need because of the bruising and the swelling. And yes, guys do it too. Okay. Let me see if there's other questions. I love her and I follow. Oh, Sujia, she's so fun. Okay, I'm trying to make sure I didn't miss. Can you do a mandible without looking square? So this guy wants to look square. Boys tend to want to look square. And yes, you can do, if you're female, you can do this, but I tell them to a certain degree. If you start trying to build out the angle of the jaw too much and it looks cool from the side, I have a good photo, but like I don't want it to be square from the front. So it's just like tread lightly. Sometimes working into the chin really helps to balance. I'm probably going to go in a minute, guys, so I can go get this baby. He's like, mama. Okay, best thing to lift the jowls if doing Botox. Sorry. My doctor said I shouldn't get filler for my under eyes because it'd make it look worse. I need to see your eyes. If you get puffy, if you cry a lot, if you have bad allergies, anyone who retains water around the eyes, don't do filler by your eyes. Nancy, what's the best thing to lift the jowls if doing Botox? Where would you get Botox to lift the jowls? This. Right here. I have pictures of that too. You Botox through here into the platysmal bands, into your neck bands, and it will help to tighten the neck. And so people will feel like, oh, my jawline looks more defined. My neck looks tighter. I have more of a swan neck. That's where you can camouflage jowls. It's not going to take away jowls all the way. It's not surgery. It's not pulling you back. I think Sujia's picture is really good to showcase jowls because you can see them. Like people don't always know what jowls are. So it's this little part where our jawlines don't look defined. As we get older, this fat pads keep separating and sinking. And so our jawline looks here. So we did filler here and filler into her chin to make the jawline straighter. I'm going to go, and this baby is like, girl, give me a drink, even though he just ate dinner and he's about to drink all night. Okay, if you have questions, I'm going to go. If you have questions, call us, text us. You can send me DMs, but sometimes I don't ever try to miss them. I try to be more mindful of that, but text it. I'm going to check these babies. They're acting like they ain't got no mama. Like I just wasn't with them at their jumping class, but I'm going to go. If you have anything, I appreciate you. I will jump on again and send a text to the team, set up a consult. Thank you guys. Bye.